Hi, Kim. Thank you so much for being here.
So much for having me.
How's your day going?
It's going good.
All right. Can you introduce yourself to our audience for a minute, please?
Sure. So my name is Kim Costello. I'm a marriage and family therapist, and I'm also a certified sex therapist. And one of my specialties is vaginismus. So I'm so glad to be here and share some little tidbits with you all.
Thank you so much. So, can you kind of start with what is vaginismus from your lens?
Okay, so vaginismus, this is a really, really easy way to describe it. And I'm sure you could come up with a lot of more terminology. But the easy way to describe it is that the pelvic floor just gets super, super tight. And so a lot of times people come to me and they go, Kim, there's something wrong with my vulva. Like every time I try to have penetration, it's hitting a wall. And I'm always so surprised how shocked they are when I tell them how smart they are and how amazing their bodies are. It's because it is hitting a wall, right? It is. And it's this muscle that just so tightens. So whenever there's penetration, it's hitting that muscle wall, which can cause pain and inability to have penetration. Mm-hmm. So that's the easy way of saying what vaginismus is, right? It's just all that tightening of the walls.
Yeah, that's perfect. So at what point do people find you? Because when I notice is people with vaginismus have been dealing this for many, many, many years before they're sitting across, in my office. So what has been your experience in terms of people actually seeking help?
Yeah, because you know what? We don't talk about it a lot. We don't talk about that, sex shouldn't be painful or penetration shouldn't be painful. So usually people are coming to me when they're partnered, right? They're partnered and they're just not able to consummate their marriage, or that it's painful, or they're wanting to have kids, but it just hurts so bad. So usually it's at that stage. I wish it was sooner, because there's so much that we can do even before that, because sex shouldn't hurt. Right?
I know. Say that one more time.
Sex shouldn't hurt.
I know you're so right about that, Kim. Because a lot of times, patients come to me when there is like a goal in mind. We want to have a baby. And now there is already that added pressure of a certain kind of timeline. So it's important that, we talk more about it so people know that they can allow themselves more time, because things take time to heal,
Things take time. And, Darshana, as you're talking and you're talking about all that pressure, what just happened to me? My whole body just got tight. So if I'm feeling pressure, I'm going to tighten my pelvic floor. So it kind of goes against what we're trying to do, which is to relax that pelvic floor, right? So pressure is not our friend. Relaxation and giving ourselves time and trusting our body, right?
Yeah,
it's really just so important.
And that's kind of like a perfect segue of my, like, the most important question I would think of this episode is, I often run into this one extreme of it's in your head. And women who are complaining of painful sex just get dismissed because it's not a thing, have a glass of wine and, it's in your head. To the other end of it actually can get to your head. So in some way, we need to address the brain to see how these muscles, why are these muscles clenching? As you said, there's this wall. Like, why does the muscle feel the need to do that, barring, any local infection or any other problem in that area, if we clear all of that? So can you speak more to why people with vaginismus need to work on some part of how their brain is wired around this thing?
Yeah, so a lot of times, and it's not just with this, it's with all kinds of things. There's a mind-body disconnect, right? So we work on our bodies, but we don't work on our mind, or we work on our mind and we don't work on our bodies. But really, we find healing when both of those can join. So let's just think about it, though. So my body, I know that sex is going to be painful, let's say. What is my body going to do? Because my body is a wonderful thing. I think that I'm going to experience pain. And so I'm going to brace myself for that pain. And so when I brace myself, my pelvic floor is going to tighten. Then I'm going to try to have some form of penetration, and it's going to hurt. What does that do? It reinforces the fact that the pain is there. So why would I want to do something that's painful? I wouldn't. Right? Yeah. So what mental health does, or what a sex therapist does, a sex therapist who really loves working with vaginismus, right? So when they do that, what happens is that we can kind of help kind of settle our mind a little bit so that we can trust our body to settle in and to relax and to experience pleasure. So when they work with you, you're working on the physical stuff. When they
Right.
work with me, we're working on the mental stuff. And together, we're bridging that mind-body connection.
Dream team.
Dream team. That's the way it works.
So I guess what I heard you is the expectation and experience kind of start to match with pain. You have enough pain where you start to expect pain. So at some level, we got to dial back and work on how do we expect things and how do we kind of get past that fear, because I do feel like fear is one of the basic things that is tied into it. So do you see fear as a part of why this hurts?
Fear is one. I also think religious sexual shame is another. The way that our families talked about intimacy and sexuality, our faith, our culture, depending on what is the story that we tell ourselves about sex? What's the story that we're supposed to, what we think about? Can we enjoy sex? Is that something that we're allowed to do? Is it just supposed to be obligatory? We're just supposed to give it to our partner? Is it dirty? Is it not supposed to be talked about? And all of those things, those start to resonate in our pelvic floor. Okay.
Yeah.
So it gets really tight. If I don't think something is good, or I've never been taught that I'm allowed to have pleasure, and all of a sudden I'm engaging something that supposedly somebody says the guy gets pleasure, the other person gets pleasure, but it's going to hurt me, I'm going to brace for that, right? Or if I have sexual religious shame and I don't really understand that my body was created for pleasure, I'm going to tighten up that pelvic floor. So I think fear, sexual religious shame, the way that our family of origin talked about sexuality and how we developed, shame in general, whether it's religion or not, because shame just kind of closes everything down. And so therapy, sex therapy, helps unwind that. So I can begin to own my own eroticism, own my own pleasure, love my body, befriend my vulva, okay,
Yeah.
and then have wonderful sex, either by myself or with a partner.
Yeah. So one of the struggles I feel is it can be intimidating for some of the patients to see a sex therapist because they're not ready to talk about sex. So I feel like the assumption there is if I see a sex therapist, I have to talk about my private, intimate matters. So can you kind of ease them up a little bit by telling, what to really expect if you're not ready to talk about certain things? How do you kind of ease into this?
Any good therapist across the board, sex therapy or not, your goals are your goals, and a good therapist will listen to you. You're the driver. You're in the driver's seat. You're not comfortable talking about that? We don't talk about it. If you're comfortable and want to dive into something, we'll sit there right with you. A lot of people are afraid to go to sex therapists. They hear that term, right? And they go, oh my goodness, what do you do in that? It's not as scary as you think. We're just normal folks that just want to walk alongside you. And a good therapist, sex therapist, couples therapist, individual therapist, will listen to you, advocate for you, and follow the goals that you want and what you feel like is important for you to bring on the table.
Yeah, I think that's good for people to hear that they have the option should they choose to use it, but they don't necessarily have to start talking about things that they're not comfortable yet. And I'm sure like as your comfort level increases, things kind of, unfold themselves sort of in any kind of therapeutic setting, if you will, right?
Absolutely.
So what's the role of the partner here? Can have you seen partnered folks dealing with vaginismus being able to resolve this without getting the partner actually involved in any
Yeah,
therapy?
absolutely. I work with a whole bunch of folks that don't bring in a partner. Usually the partners are just so understanding and just so wonderful, right? And they don't want to hurt their partner at all. Okay, so I've done both. I've worked with it individually and I've worked with them both. And both are just fine. Okay.
Okay.
Individually, we're going to work on embodying your own eroticism. We're going to unwind thoughts about your body and about sex. Partnered, we're going to talk about how to help each other during this, right? And how sexuality and urges aren't wrong and aren't bad. One thing, though, I want to acknowledge that if the partner has a vulva and the other partner has a penis, okay, the vulva owner has vaginismus, it's not uncommon for the penis owner to experience erectile dysfunction once vaginismus is kind of over, right? Because the penis has caused pain, and that's the last thing that the partner would
That you
want
want
to
to do
do.
to a loved one.
Yeah,
Yes.
yeah. So I just want to normalize that we don't live in a bubble, right? Some things play off the other. So if I'm working with someone who has a vulva and they get to the place where they want to have penetration, there could be some erectile dysfunction there that could happen just because the partner's saying, I don't want to hurt you. What causes me pleasure has caused you pain, right?
Yeah. Thank you for saying that. A lot of time there isn't enough awareness that that could happen, right?
Yeah, definitely, definitely. So
Particularly
that's the
folks who
benefit
have,
of,
yeah, I
oh,
was saying, I'm
sorry.
sorry to cut you off. I was saying, particularly folks who have just avoided this for many years, that there is just, it's sort of like learning a new skill all over again.
Absolutely. Absolutely. And when you're in a loving relationship and one that cares, what you don't want to cause each other pain, right? So that's where the mental part comes in, right? Is that we got to work with this understanding that we're a team in this. And how do we get better as a team? Okay.
Yeah. And can we talk a little bit about, we talked about how guilt and shame and religious, certain narratives can play into this. What I often see is, stress levels. Um, it's sort of a loop of there's so much stress and so much that life needs from you that people aren't able to do things that are supposed to be helpful. And it's sort of like you're stuck in a loop that you're not able to do what you're supposed to do, which just causes more stress. So can you comment on, do you see that to be commonly the case for, clientele?
Absolutely. I think, even with COVID and even before COVID, life is hard. And so sometimes even just getting the help that we need is hard. So we freeze, right? So one of the things that I tell my clients, and so now the audience can also kind of look at, is where do you hold your stress? Like, do a body scan. When I hold my stress, you're going to see me rub my neck, right? But a lot of times people will like tighten their thighs, hold in their stomach, do a Kegel when they're stressed, and they're holding all of that pelvic floor. So one of the things is with stress is it could be just as easy as, and it's not as easy, right? But to breathe through and relax that pelvic floor instead of tightening it all up, right?
Yeah.
But it's hard. It's hard to like go to the PT. It's hard to do the things that we're supposed to do. But if we can learn to do this body scan, it starts to help say, okay, I don't have to do big things. Just in this moment, I'm going to allow myself to relax and let go.
Yeah. Yeah. The brain thrives on success. So what I'm hearing you say is give it small tasks. So you
Yeah.
feel motivated to do it, right? Because it's
Yeah.
so intimidating to have this long list of things you're supposed to do that you really never get around to doing. And that's everybody's
So
struggle, right? You and I included.
yes.
So
Yes. This
yeah,
freezes
doing
us.
something little can also kind of keep walking on that path. I wanted to ask you if there is anything that you can recommend for folks who are dealing with vaginismus in terms of addressing not the guilt that's causing vaginismus, but it's almost like cause and effect because they feel guilty that their partner is not getting what the partner is looking for, or partners are very supportive. Nobody's feeling pressure, but they still feel bad that they're not able to be with their partner in that way, which just feeds into the guilt, which just feeds into the vaginismus. So are there any recommendations or anything that they can do to ease that part?
Oh, this is my funnest part. This is my funnest part. It is to teach folks on how to expand the definition of sex and erotic play. That is not just penetration and orgasm. It's living erotically playful with another and with yourself. Okay. And it's just so amazing how, and you could call that flirting or whatever, but it's just so amazing that as you start to engage every day into really loving your partner, showing that flirting, engaging in sexual play that doesn't lead to penetration and orgasm, how much fulfilled sexually you can be. So, and then we begin to underline, who said that the best sex is, penetration all the time?
Yeah.
Where did we learn that? Where do we learn that? So unwinding that and then allowing, instead of having this big of a bucket of sexual pleasure, you leave with this big of a bucket of how to engage in sexual pleasure with your partner.
Yeah, that's interesting because you're right. Like a lot of times, sex is penis and vagina penetration is the classic definition that I hear from my heterosexual couples, and I feel like that puts more pressure because there aren't choices. There's one thing.
There's so many choices.
Yeah.
There's so many choices. And so I call it simmering, right? So it's like the crock pot going. It fills up the house, throw it in at 7 a.m. By 5 o'clock, I'm like, nobody touched my stew. It tastes wonderful. And how do we do that erotically and play 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 and play?
That is a great analogy.
Yeah. And then before you're like, nobody touched my stew, right? Metaphorically, nobody touched my stew. And so we begin to engage. And another thing is if we focus just on penis and vagina and orgasm, it kind of sets us up if we get sick, a disability, if we get older.
Yeah.
Right. So my goal is for my clients to be 115 and have great sex.
Great goal.
Great goal. 115, great sex. And it doesn't have to be penetration and orgasm. It's living erotically with somebody that you love.
Yeah. And I think that's just really applicable to my people with secondary vaginismus who have once experienced pain-free penetrative experiences, and now they're dealing with trauma with childbirth, they're dealing with chemotherapy or menopause or other things which have kind of created an issue in the tissue, right? So there is that real fear of tearing something. So how do you handle that differently than people with primary vaginismus? Because, and correct me if I'm wrong, what I typically see is primary vaginismus, there's a lot more psychosocial things to work through. With secondary vaginismus, it's just even harder for those folks because they've felt and known what it is to have pain-free penetration.
Yes.
Right.
So then there's grief. We've got to do a lot of grief work because a lot of people are telling me, my body has failed me. So grief work.
Yeah.
Number one, how to kind of befriend our body. Okay. Then we've got to reclaim what it means to play and have sex and be close, because we probably have only known it in a very limited way. Okay. But if we don't grieve first, it's really hard to feel hopeful for that big bucket that I was talking about, right? Of all the different ways. So I do it a little differently because we do grieve. There is a grief.
Interesting. I never thought about it that way, but it totally makes sense. There is a grief of something that you had that you kind of lost.
You lost.
Yeah.
And it feels hopeless. Like, is there any hope for me? And I always say there's tons of hope, right? For both primary and secondary, tons of hope. But yeah, it's like, oh my goodness, this worked fine. And now it didn't. And then we were dealing with the trauma for whatever, if it was a birth, and you want more kids or you don't want more kids. How does that engage? I had cancer, or I'm going through cancer. There's a grief around sickness, menopause, everything in my body is changing. I don't know what to do. It feels like the Sahara Desert in there and it hurts. There's a lot that we've got to maneuver where we begin to sink in and begin to love the stage that we're at, even in some difficulty.
Yeah. Yeah. And I think that's especially harder for people who are partnered, because as we talked about, that further guilt of what the partner is experiencing. But how would you encourage people who are not currently partnered? And is there value in seeking, because sometimes I feel people with vaginismus, if they will deprioritize certain things, if I'm not currently partnered, so I don't really need this, what would you say to that? Is there any benefit to seeking out sex therapy even when you're not currently partnered?
Absolutely, because we want to love every aspect of your body. And a lot of times we say we're not currently partnered, but there's a disconnect between the way that we make peace or become friends with our vulva, right? Right. And so that helps. Number two, there's a lot of pressure once you're in a relationship to kind of
Sure.
look a certain way. Okay. And thirdly, there's always this understanding of, no, I'm just broken. There's something wrong with me. I promise you. I've had people say, I promise you, Kim, I promise you, there is something wrong with me. And when I tell them, no, your body is just okay, they're shocked. So helping beforehand, before you get partnered, is always beneficial. And then plus, if you're not able to use tampons, you get to use that more. You get to explore sexuality by yourself more. You get to help. Sometimes it affects self-esteem and what it feels like to be a woman. All of those things help.
Yeah,
So going to see you for the PT, coming to see me for working on all of those thought processes, I think could only help us.
Yeah, and research kind of supports that, right? Like people who are getting multidisciplinary approach, whether there is a physician involved who's making sure all the medical aspects check out, a psychotherapist, and a pelvic floor PT, those folks tend to have the best outcome and most, longevity of the outcome. So research kind of backs up what you just said. And just to build off of people who are not partner, in my, in my practice, what I see is usually people with vaginal pain will tend to develop some bladder issues, bowel issues, because those are the same muscles that are controlling other outlets. So we often deal with constipation or pain with bowel movements or frequency, urgency in the bladder. And so yes, penetration is one part of your bodily function, but these are other functions that can then start to get affected. So there's definitely benefit from my angle for that, from pelvic PT angle. Like we need to address that. And also just vagina owners need like a well check once in a while to make sure cervix is doing okay, cervical cancer checks. And what I often find is people just avoid those appointments. They just won't go because the speculum hurts too much. So there is that whole other piece of that has nothing to do with sex, but has to do with your overall health. And of course, sexual health is a part of your overall health. But sometimes I have to I can get people to understand that part, but they don't see the value. Well, I'm not partnered right now. I'm like, this will get you ready for being partnered if you want to. Right?
That's right. That's right. So and also help with all the other things that you talked about.
Correct. Yeah. So what can the partners do to support their person going through vaginismus? Because, a few times I will have patients bring their partners here, and it's just so nice to visually see the support that they experience. So what do you have any tips for partners how to support the journey through this?
Yeah. So really encouragement, letting them know that they're beautiful and that you're there with them. If I see a couple together and we're talking through things, sometimes I'll give exercises that they can do together. Even dilators. I have the partner help with dilators. And as they're doing the dilators with the partner, make it erotic, right? So they set the stage, they take a bath, they do this, and then the partner says, thank you for letting me do this. You're so beautiful. Your stomach, your hair. I love looking at you. Thank you for doing this with me. You're safe here. So all of that can really, really help, right? To create safety and to encourage, right? And also to know that your arousal is not bad. Okay. So the partner, often feels a lot of guilt, right?
Yeah.
Because what I feel pleasure and it hurts my partner. Your arousal's not bad. There's nothing wrong with wanting to have sex, and there's nothing wrong with wanting to have intercourse. So kind of free them up to also know that, right? And so to be willing to expand the definition of sex will not only help the person with the vulva, but it will help their partner too.
Yeah. Yeah. And how do you help them in terms of setting some sort of controls, so to speak? Because I feel like there is this little fear of, if I do this, then he's going to expect that kind of thing. So is there
Oh,
like a
that
boundary
happens
setting?
always. Oh, yeah, that happens always, and not just people with vaginismus, right? Desire
Yeah.
discrepancy, erotic conflicts. If I hug him, he's going to want. If I hug her, she's going to want. Fill in the blank. So what we do is it's caused by anxiety, right? And so when I talk about anxiety, what normally happens is your pelvic floor starts to tighten, 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 tighten. Okay, so I just want to acknowledge that whenever we feel
Yeah.
anxious, we kind of close up. So what we do is we begin to say, okay, we're going to do this, but not this. And we really, I call it slicing it thin. So I really, as a therapist, really paint the picture of what it's going to look like, and I slice it really, really thin. And it's so structured that the anxiety disappears because there's no room for error.
Yeah.
I've taken away everything that I could think of. What happens if the kids come in? What happens if the dog barks? What happens if the phone rings? What happens if the stove overflows? So I
Yeah.
pull through everything so that we can learn how to negotiate and create this moment together to be super safe and super pleasurable.
Yeah, that's great. So usually it's the unknown that makes people anxious. So what I'm hearing you say is like, take out all the unpredictable variables as much
Oh
as you
yeah.
can.
Yep.
Yeah.
Do we turn on the lights? Do we turn off the lights? Do we do this inside? Do we do this outside? How long? How not long? Are we clothed? Are we not clothed? So that's the thing about a sex therapist, right? Is because I get to walk through and I get to do all the thinking for you. And then you get to say what you consent to or not. What feels safe, what doesn't.
Hmm.
And so then we can shape a sexual encounter. I'm not talking about penis and vagina necessarily, right? But a sexual encounter that is fulfilling and safe and gives us a renewing of hope.
That's great. That goes back to that experience. We just gave your brain a positive experience. So it's going to expect a little bit different the
Yeah.
next
So
time
that
it is in that environment.
instead of my mind saying this is going to hurt, it will begin to say, maybe today it won't like last time. And then we
Yeah.
start building on that. Maybe it would be as good as, you know what, I really like Tuesday night. I think I want to do that again. Right? And we start building on that and we create a new story around sexual health.
Yeah, that's exciting. So I often feel like patients who are seeing the sex therapist first and then find me are already using dilators. So can you tell me a little bit about what sex therapists do? Like, do you guys recommend using some self-treatment? Like how does dilator, I know how dilators fit in my pelvic PT world. How do
Mhm.
you guys use them?
You know what? I always tell them to go to you when it comes to dilators. The big thing for sex therapists, we don't touch our folks, right?
Correct.
And I can't look inside your body, but you
Mhm.
can. So I always tell them, like, these are some of the things that you can do. And if you go to a PT, they can kind of help you on how to utilize this the best way. And this is kind of what you talked about before. I call it the trifecta. You didn't
Mhm.
use this word, but I call it the trifecta. The most help that I've seen in my practice is when you go to the doctor to make sure everything's fine, you go to a PT, and you go to a sex therapist. It's like the
Yep.
perfect trifecta.
I'm going to use it.
Yeah, it's the trifecta. It's like awesome. So I immediately say, here are some options. I want you to go to this PT. I want you to ask about dilators. I want you to go to the doctor and ask about internal Xanax and, and begin to kind of just talk this through. So
Yeah.
you leave the office feeling a lot of hope.
Right. So how do we take this the next level? Because sometimes dilators are great. People have progressed through from size 0 to the size that is bigger than the partner, and everything is perfect in my little treatment room here. And it fails when it is the actual thing, right? And that's where it just goes to show, mind is playing into this because the tissues are ready, right? And it can be incredibly frustrating for that person because they just made all this progress here. And now, why aren't things working? So, can you comment on, what to think of that, what to make of that? Just,
Yeah, it happens all the time. Okay. And it's like what you said, is that our mind has a lot to play on it. And quite frankly, and of course it shouldn't, when they're in your office, that's medical. There's nothing erotic about it. Okay. So, but now they're moving the medical to the erotic. And that's my job, is to help that transition, right? So when we do the dilators, what do we do? How do we relax? How do we feel erotic during them? How do we allow ourselves to move in? What can we do, or what have we found out when we've expanded the definition of sex that helps us relax and helps us really sink in to our erotic self and really get our arousal going, right?
mm-hmm.
So when you're moving from the medical to the erotic, there can be a little bumps in the road. It can be a lot smoother if you're working together with a sex therapist and a PT, right? And together we can talk about how to make these things more erotic at home. And then how to help when that day comes. And then to encourage that if there was a little blip, it's okay. Just a little blip.
Yeah.
We can get past this. Right? And then move forward.
Yeah, it's important to get that support during that transition from PT
It is.
to life. And I think it'd be important for listeners to understand that it's not just because, sometimes when you hand somebody a set of dilators, we're sort of, without saying it, we're saying that when you get through this, that's the finish line. And it can
Yeah,
be
it's not.
frustrating to realize that's really not the finish line for some people, right?
It's not. So it's this whole thing about making the medical and transferring it to the erotic.
Yeah. Yeah.
Right?
And can we talk about, vaginismus in people whose partners also have vulvas? So are there any different considerations around that when we're dealing with vaginismus?
You know what? The big thing is support and love. There might be some feelings of grief that come up, like what's wrong with my vulva, right? What's broken with me?
Mm-hmm.
So it's processing that, right? It's processing that. And again, it's expanding the definition of sex, right? So if a person cannot put in a dildo or cannot put in a sex toy in the vaginal canal, what else can we do to really make that beautiful, that connection with each other? Super, super, super meaningful and beautiful, right?
Yeah, yeah. So it boils down to the same principles. It
Same
doesn't matter
principles.
your orient. None of this matters. It's
It
sort of
doesn't
the
matter.
same path you walk, right? There is the other kind of vaginismus that I feel might help from talking a little bit about is around fertility issues. There are folks going through assistive reproductive technology, and there's just a lot of things happening. So many procedures, so many ultrasounds, so many injections. Do you ever see that? Is there anything differently that would benefit them?
Well, so I'm not sure the question, so you might have to ask me again. But what I have seen is people with vaginismus want a baby, so then they go get IVF or something like that so that they can have a child.
Mm-hmm.
Is that what you're talking about? Or that
Yes
they
and no.
do that and then afterwards they get.
Yes and no is like, I feel like they have vaginismus and they're going through, IVF or IUI, and there's just a lot of stress to go for these appointments because there is going to be a speculum that's going to be placed in. So now we're just talking about adding trauma in addition. and it just sort of becomes like such a complicated situation.
It is very, very, very difficult, right? Because not only not being able to get pregnant is really, there's a lot of grief to that. Then putting the trauma through our body, through everything that we have to do. Okay. Then having it be painful.
Correct.
Okay. Then having a baby. And sometimes the baby could be colicky or not sleep through the night. And we've just done all this thing and it's not as wonderful as we thought it would be right now. And it's just so hard. There's just so much there.
Yeah.
Right. So how to be gentle with our bodies, how to listen to our bodies, how to love our bodies, how to respond to our bodies, how to give ourselves a lot of grace. We're really hard on ourselves.
I know. And we're usually not good at being kind to ourselves.
We're not good at being kind to ourselves. So we're like, just grin and bear it. Just grin and bear it. I'm going to get a baby. Just grin and bear it. And then afterwards, we're like, oh, motherhood is hard. It's so rewarding and hard, you know, and then things have changed and it still hurts. And a lot of grief, right? A lot of human grief, a lot of human difficulty. And this is where we need just a lot of support so we can realize that we're not alone. There is hope and there's a way to cope. But number one, even before all of that, I just wish we could learn to be gentle to ourselves.
Yeah.
And
in all areas. Yeah. So are there any resources for somebody who doesn't have access to a sex therapist? So
yes.
I do recommend people go to sex therapy, but realistically, some people just are not there. They're not willing.
They can't
afford and don't have
away.
Yeah.
Time.
And sometimes there isn't a qualified provider near. So what would you recommend for somebody who doesn't have access to therapy in general, sex therapy aside, but just they don't have? Are there any resources that are like self-help? Like what can they do to kind of DIY it, if you will, if there isn't any other choice?
I purposefully, a colleague of mine, Mia Fine, who I just love, made a program for specifically this, in case people could not go to a sex therapist. It's educational.
That is great.
But it kind of walks through all of these stages of how to help ourselves. So that's one that we've put in so much work in it. I'm really proud of it too. I hope people just use it and get lots.
That is great. Yeah. I didn't know that existed. So that'd be great because a lot of times people can do that at their own pace.
They can do it at their own pace, and they can go like session 1 and then session 2. We lead you through journaling. We lead you through mindfulness. We lead you through education and how your body works. We talk to you about erotic playfulness and how to engage with a partner, how to engage solo, right? Yeah. So it's really good. So that can be found at www.healingmomentscounseling.net. And it's right under courses.
I'll put that in the show notes. Yeah.
Okay. Thank you. And so that's one of them.
Mm-hmm.
I love that. Headache in the Pelvis is what I read. Have you read that book? It's so thick and hard, you know, so that one is really, really difficult to read, but I like it. And I also love Come As You Are, you know, because, you know, the Cliff Notes, I don't know, I'm pretty old for the Cliff Notes, you know, line that to the Cliff Notes whenever I had to read a book in the library. But the Cliff Notes, what I love about the book is like, you are normal.
Yeah.
Chapter 1, chapter 2, you're normal. Chapter 3, you're normal, right? And it's just this really empowering way of being like, okay, I got this.
Yeah. And isn't that something that people ask in different ways all the time? Is this normal? Is this normal?
All the time.
You just ask the same question in many different ways.
In many different ways. I'm not sure how I feel about this. Yes, you're normal. Are you sure this is the way it's supposed to happen? Yes, you're normal.
So here is my $1 million question, which patients ask me all the time. Will this ever get better?
Yes.
Do you see it getting better?
Yes. One of the things that I love about working with vaginismus is that there's this struggle, right? There's this struggle. And then there's this breakthrough. And there's so much joy. And then I get postcards like a year later thanking me, or pictures of a baby, or telling me they've had the best sex. Don't get me crying.
I hear you. I always get like, you know, weird time of the night, an email sent to me, I had sex and I thought of you. This is the life of a pelvic PT. Taken out of context.
Yeah,
But and that's like the best email to wake up to,
absolutely.
because it is so hard for folks to talk about such a private issue. It is incredibly hard. And I'm always, in awe of my patients who just are here. You're brave. You show up, you do the work. It is incredibly hard to be that vulnerable and talk about private issues. So I get the work that goes into it, right? So I totally hear you. It's so rewarding to get that
So
card or see
rewarding.
that, email. It's just amazing.
And I don't think I could keep doing it if it never worked.
That's a good point.
It would be too discouraging.
Yes.
Okay. So I love this work because it's hard at first, and we're really getting deep. There's some pain there, physically and emotionally. It's both. And then all of a sudden, we see movement and more movement and more movement. And I go, yep, that's why I do what I do.
Yeah, it's pretty empowering, and
it really is.
I think people need to hear that it does get better, because in the minute it may feel like it's never going to change. And truthfully, by the time people see you or me, they've been dealing with for so long that it just feels like,
there's no hope. There's hope.
Yeah, there is.
There's hope.
Yeah, I think that's a great note to end on. There is hope. Thank you so much. I want to ask you, is there anything else that you often get asked, or you feel like as a sex therapist dealing with vaginismus, there is a piece of information people need to know and they don't know? Is there anything that you want to talk about that I should have asked?
Big thing is you're not broken. Second thing is really use the trifecta, right? The doctor, PT, sex therapist, or using your do-it-yourself kind of classes that we talked about earlier, and really get people around you that will cheerlead you. And here's another thing. More people have sexual pain than you think.
Yep.
So people think that they're the only one because we don't talk about it because it's so embarrassing for whatever reason. Who taught us that it would be embarrassing? Society, parents, who knows? Yeah. But there's more people out there. You're not alone. Yeah. And there's lots of hope.
Yes, you're right. People always feel it's happening only to them. And you're right. It's just a lot more common than we think. We just don't talk about it, but it is. I mean, my schedule's always full. That tells you how common it is, Me
too.
All right, Kim, I wanted to take a minute so you can tell people if it is okay to contact you.
Absolutely.
How can they reach you? Where to find you?
Absolutely. So my website is www.healingmomentscounseling.net. That's where you can find the course. And Kimberly.Castelo, Castelo .llc@gmail.com. And I'm sure you can put that up too.
Yes, I'm going to put all of that in show notes.
Email me, do whatever. However I can help you, I would love to. We're in this together.
Are you working with clients? Do you take clients or do you only mentor people now? What's your deal?
I take clients.
Okay, great.
And I have a whole bunch of people that I'm training to also take clients. Okay. So, yeah.
So is there like a resource, like the ASEC directory? Is there a resource for people to find a therapist near them?
Yeah, so ASECT.org, AASECT.org has a whole list of sex therapists, and you just type in where you're from and they can tell you.
Great. And I think with telehealth now, you don't have to find a local therapist. As long as, you have telehealth, you're good.
Yeah.
Yeah, this was great. Thank you so much, Kim.
Thank you.
Any parting notes for our people here?
Oh, I just believe in yourselves. Be kind to yourselves. And get people around you who will celebrate you, right? And support you. And we got this. We can do this.
Yeah. All right, people. So that was Kimberly Castelo about vaginismus and sex therapy. I think if you're going to walk away with one thing, it is that it can get better. So just work on it. Find your trifecta. And, it takes work. It's not easy. We're not making it sound like it's not work. But it can be rewarding. And you don't have to struggle with this. Right? All right, Kim, thank you very much. Have a wonderful rest of the day.
Thank you, guys. Have a wonderful day, too.
All right. Peace out, people.
Bye.
Bye.
cheat on you. Want you to me. I want you